students starting the school year, and with that comes a lot of issues.
Today, the CDC released a report looking at seasonal trends in emergency department visits for children and adolescents from 2018 to June of this year. That study found nationally visits for behavioral and mental health reasons increased in the fall semester as compared to the summer.
Dr. Scott Hadland from Mass General for Children joins us live to talk about this. Dr. Hadland, good to see you. Thanks for your time.
Good to see you too, Ben.
All right, so how can parents best support their kids as pressures from the school year start to ramp up?
Yeah, this was a really interesting study that showed results from more than 2,000 emergency departments across the United States. So this is a clear trend that kids really struggle in the fall and spring. So that's the thing that parents really need to take with them is to know that going back to school is hard. And I think what's most important is for parents to check in early and to check in often with their teens to see how they're doing. You know, teens experience a lot at school, right? There's the academic pressure. There's sometimes some social anxiety around being around all those people after a summer of being apart from them. Some kids are frankly bullied. And so I think it's important for parents to approach conversations with their teens early and often and approach these conversations from a place of curiosity to ask how they're doing and just frequently check in, knowing that, you know, a teen might shrug you off the first time, but if you keep checking in, it offers an opportunity for you to understand as a parent how they're doing. And if you need to intervene, then you get the information you need.
Well, so Dr. Hadland, the report also found an increase in visits during the school year for adolescents dealing with cannabis-related disorders. So when should parents be talking to their kids about drugs and anything they should be saying about marijuana in particular?
Yeah, you know, in my practice, I care for a lot of teenagers who are struggling with addiction to alcohol or other substances and see a lot of teens really struggle with cannabis. And some of the patients that I have are as young as, 10 or 11 years old. And so there really is sort of no age that's too early to start talking about these things, of course, in a developmentally appropriate way that is appropriate for your child. I think it's so important for parents to counter some of the messaging that teens hear, right? Teens are constantly hearing cannabis is natural, so it's got to be safe. It's legal now, so it's got to be safe. And we actually know that based on research, cannabis has a lot of harms for the developing teenage brain. And so it's important that parents send counter messaging that they recommend that their teen not use.
All right, Dr. Scott Hadland with Mass General, we appreciate your time. Thanks so much. Have a good weekend. Stay dry.
You too. Thank you.
Yeah, thank you.